or any updates, any questions about any updates or things that were going on. And so what we decided to do was to continue these. And we feel like this is just a really good way, again, for us to touch base with you, give you an opportunity to ask us questions, and just everybody just kind of stay in communication with each other. So the way this works, we're going to start off by just sharing some updates with you all from the division, some things that are coming up. Is my screen still sharing? Do you still see the PowerPoint? Okay. All right.
Yes.
Okay. Thank you. Just wanted to make sure. So we're just going to give a few updates of some things that we've got going on here at the division. And then after we've had an opportunity to give updates, we will address any questions that you all might have. Just as a courtesy, a couple of housekeeping things. If you all please will just keep yourself muted so we don't get any background noise. If you do have questions, when we do get to the question period of the session, you just type that question in the chat box, and we will go through those questions and answer those questions. Just as a reminder, we do not answer questions that are about a specific child care program or questions about a specific child care certificate. Questions about general policies, general updates, programs that we've got going on, those types of questions are fine. If you do have questions about specifically about your program or specifically about one of the families that you serve, you need to email our division, or you can contact our division through our call center. So that being said, we're going to get started with just some general updates. So first thing that I wanted to say is today was the last day to participate in the 2024 market rate survey. The market rate survey was being conducted by the Social Science Research Center at Mississippi State University. I do want to say just a big thank you to everyone that did participate in the market rate survey. I know that it takes some time out of your day or evening to participate in that. And I know that everyone's time is precious, but the market rate survey is the single best way that we can, right now, that we can ensure that we are setting our reimbursement rates at a level that is needed by you all. So just a thank you to everyone that did participate in that market rate survey. We do appreciate that. Coming up in the next couple of months, we will be releasing a report that will we'll be working with the Social Science Research Center to create a report that we will be sharing out with you all on the results of the market rate survey. So another thing, one of the big ticket items that's up right now, our triennial, that means every 3-year CCDF state plan is currently being worked on. The draft of that plan is due to the Office of Child Care on July 1st of 2024. Now, what that means is we submit a draft to our federal partners. They will review that draft, and then they may or may not accept the state plan. There may be additional questions that they ask based on what we have submitted. There may be additional changes that they request, but the draft will be due to them on July 1. Now, before we submit that draft to the feds, we will be holding a public hearing on July 12th, 2024 for public comment and feedback. Now, during that public hearing, it will be a 2-hour time period. You all or anyone else that would like to provide public comment and feedback on the state plan will be allowed to sign up for public comment, and they will be able to make public comment during that session. Now, that is not the only time that you will be able to offer public comment. We are going to release the plan for written public comment beginning May 24th. And also on May 24th, we will be releasing a link to the plan, as well as you will have an opportunity, and we are going to use Smartsheet that will allow you to provide written comment on the plan. And those comments are taken just as seriously as anything that is said during the June 12th hearing. but it's to give you all more time to read through the plan. And we do know that sometimes, you know, you may have more feedback than the public session, the one public hearing session will allow. So we do give you the opportunity to provide written feedback. So we will open the plan. We will release the draft of the plan on May 24th, and it will stay open for written comment up until the June 12th public hearing. So when we end the public hearing on June 12th, we will also close the written public comment period. After that, after the June 12th period, we will take all of your comments, all of your feedback. We will incorporate any potential changes or edits into the state plan that will allow. We will submit the draft to the Office of Child Care. They will do their reviews and everything. Any requested changes that they may have, they'll send, you know, out to us or send back to us. If it is determined that there are changes that are needed to the state plan from the draft that we submit, we will hold another public hearing before we put the state plan officially into place. And again, we will, just to give you an opportunity to weigh in, provide public feedback before we file the plan officially with the feds and with the Secretary of State. So again, just important dates to keep in mind. May 24th, we will open up the plan or send the plan out to you all for written comment. On June 12th, we will be holding a public hearing and to allow you to make comment, give us comments and feedback as well. Now, we will be sending an email out with these reminders, and we will send you out multiple reminders about these dates, okay? But I did want to go ahead and just mention these dates to you so you could go ahead and get them on your calendar if so you can just be aware. We do encourage, we want everyone that has feedback, we want them to weigh in. That's the single best way that we can ensure that our state plan is meeting your needs. So again, I know that it takes some time to review the state plan, but I hope by giving you the additional time up, you know, prior to the public hearing, will give you time to review the plan and provide any feedback that you need to. Okay, we also have sent out the first round of the school age reimbursement payments. Those payments went out via direct deposit. I believe it was sometime last week. We are working with Horn. They were the contracted vendor for this program. So when I say the first round of school age reimbursement payments, that was the bulk of everyone that was eligible for that program. What Horn is doing right now is working on preparing payments for any providers that did provide those full-time school age care services during the pandemic, but were not reimbursed at the full-time rate, but since then may have changed their location or changed their license number. So what that means is if you did provide those school age services, you had a child care, your program was open and operating, you as the owner were open and operating and did provide those services, but since the pandemic, maybe you've changed location, which is the primary reason why people's license number changes, is they've moved to another building. Some of you have been able to take advantage of like the Child Care Strong. You've been able to move into a larger building to serve more children, which is fantastic. But what we have to do is we have to go in and verify that you are the same person that provided the services during the pandemic if you have received a new license number. And so what Horn is doing right now is they're verifying that to make sure that anyone that has a new license number was in fact the same provider that provided services previously, even though they may have a new license number. So we do anticipate a second school age payment going out. I do not have the date right now. I do not know how soon that will be. But just to let you know that if you did not receive payment in the first round, it's more than likely because your license number has changed. But again, you were only eligible for the school age reimbursement program if your child care center was open during the pandemic and you provided full-time services to school age children who would have normally been in school, but because their schools were closed because of the pandemic, or possibly they were more than likely doing like virtual learning. Some of you were, out of just the sheer goodness of your hearts, allow those school agers to come. We were not able to reimburse you full-time at the time because of the way our eligibility for the program works, for the child care payment program works, but we were able to get approval from the feds to go back and pay you the difference between the part-time and the full-time rate using rescue plan dollars. So that second payment is coming out. Now, I will say, if you do have any questions or there are any issues with the school age payment program or with the teacher incentive program, those questions must be addressed with Horn. And I've got the phone number and the website up here for you. Do not contact our office about the school age program or the teacher incentive program, okay? Unless you're having some issue, you've already tried to contact Horn, you're not getting any response from them, which should be unlikely. But do not contact our call center about either one of these programs. Our call center, we are not administering this program. We've contracted this out. Our call center folks are not going to be able to answer your questions. So make sure that you contact Horn directly. Phone number is there, 601-258-3402, or you can visit the mseccdi.com website. There's a contact us link on that website. There's also information about these programs as well. Okay, as y'all know, summer is coming up, and we just wanted to remind y'all about the policy regarding closures. So I'm going to let Angela talk to y'all for a couple of minutes about that.
Good morning, everyone. Just a quick reminder, I know that when we sent this notice out for the Christmas holiday, it kind of blew up. So I just wanted to make sure that we really clarify what it means to be closed. So we're not telling you that you can't be closed for the days that you already have planned in your policy manual or your handbook that you give out to parents. The days that we are referring to are the days outside of the days that you have set in your calendar. So we call those kind of voluntary closures. So if you're closed more than what you already have established as closing days for your center. So please just be mindful. If you plan on taking additional days, look at that. Look at your policy manual, rule 8.8, the allowable closure days. In there, it gives you, days that you can switch, so let's say you want to be off an additional day for whatever reason, that's outside of what you have scheduled because it falls on a weekend or something, like a Friday. It's an additional day, especially like the 4th of July, and you decided you want to take the Friday off as well because the holiday is on Thursday. What we're asking you to do is to look at your additional days that we give you, which is in the policy manual, and switch one of those days that you wouldn't necessarily want to use, that you would want to close. Maybe the holiday that we're going to give you falls on a Saturday or a Sunday. Well, that's an additional days that you can swap out. Go into your portal where you complete your ledger, and you see all those tabs on the side. Go into the holiday tab and switch those days out. The rule is that you have to give parents 14 days and us 7 days. So once you switch that in the portal, you're able to, that's saying you're switching the day out. Once that day arrives, then when you open up your ledger, you'll be able to just switch it to a full-time, it'll be an H or an N for whether the student is a full-time student or a part-time student, but it'll already be populated for you to use it as a paid holiday versus a full-time, part-time. So that is very, very important for those days that you use when you are switching out. You have 5 of those days that you can maneuver around at your leisure. And so we just want to remind you that we're just saying the voluntary closures, like if you were going to be closed 2 days, you've already used all of your holidays or your days that you would be able to allow to switch. And then you say, well, I'm going to be closed for the week. Well, that's against the policy for us if you're a subsidy provider. So I'm just saying, just use your days wisely for your closure, especially I know some of you like to do professional development, which is a different code. You get 3 days for that. So use your professional development days for your professional development. And so if you have any questions, I don't have a problem walking you through it. You can send me an email, but just make sure that you use the days accordingly. I just want them coded correctly to ensure that if your center is closed for a day that you switch, that you're not using an F or a P or the Z or the X or whatever it is, because those aren't days that you can use. You need to use it appropriately for the day of closure that you have for the holiday. The second thing I want to remind everybody is for field trips, when you're taking them, policy states that a child care center shall remain open on days when children are taken on field trips or any other day outside of the approval holiday list provided by MDHS. For any children who cannot attend the field trip or still need childcare during the holidays not approved by MDHS. Please remember, try to make sure that, you know, when you're making your list for field trips, it's accommodating to all families so that everybody can participate. Otherwise, the center has to be open. And I know that we're not in a position where we can have care for one child and everybody else is leaving to go on a field trip. So just be mindful of that. And I think that's it for that. If anybody has any questions about the portal, please send me an email. I don't have a problem answering your question or walking you through how to switch that. We do have a video online where we did do a lesson, a training on that, and that can be accessed as well on our website. And that's it for that, Chad.
Okay, thank you, Angela. Okay, one other thing that we wanted to just remind you all about is our direct deposit policy. Some of you have been contacting our division about changing your banking information. We do not keep banking information on file. We do not control that. Our vendor, which is FIS, that handles direct deposit, that is who you must contact to update your banking information. We will not change any banking information on your behalf. You have to contact FIS directly. Now, if you need to know how to contact FIS, you can ask us about that, and we will make sure that you get the proper contact information for the vendor. But we do not send your banking information to us, please. You'll need to contact FIS directly to do that. Now, FIS, if you're changing information, just be aware that depending on when you make the request, there more than likely may be a pause in your direct deposit. Now, during that process, you will get a paper check until FIS gets you cleared to receive direct deposit with your new bank account. You may contact us to verify your mailing address. And it's probably a good idea to do that because otherwise, especially if you change locations, or even if you've moved and your check has been coming to your home, whatever, you'll need to check with us to make sure that we have your correct mailing address on file. Because otherwise your check is going to go to whatever address we have on file. So you may contact us about making sure that your mailing address is correct, but do not contact DECCD about your banking information. Okay. And also just a reminder about direct deposit, the way that process goes. So our policy is we issue payments twice a month. All right. Our policy is that we will issue payments by the 15th of each month. Okay. And we're adhering to that policy, but you also all need to keep in mind that there are several steps that are required for us to get the payments ready to send out, because some of you have been complaining that your payments you're not getting your payments until a day or two after the 15th. Y'all, we do not control what your banking institution policy is on direct deposit. Okay. If you'll remember, even when we were sending out paper checks weren't usually going out until the 15th. And then some of you weren't even getting those until 2 or 3 weeks after the payments were being issued based on whatever the post office, them getting the checks from us to you. So we do get the payments out on the 15th. That does not necessarily mean that it will hit your bank account on the 15th. Again, that is completely dependent on whatever your banking institution's policies are around direct deposit. So we do get the payments out on the 15th. We work very hard to make that happen, but there are several steps, including us, including us getting approval from the Department of Finance Administration to release those payments. So sometimes, depending on, if someone is able to make that approval over there, sometimes we get the payments out prior to the 15th, sometimes not. But we give you all until the 10th of each month, right, Angela? It's the 10th of the month to get the ledger.
It's the 5th
Fifth.
and
The
15th.
5th, that's right, 5th, that's right, 5th and 15th. So that gives us 10 days to get those payments ready to go out. So just again, we work very hard to get those payments out by the 15th, but just because we get the payments out doesn't mean that they will necessarily hit your account on the 15th. Again, that just depends on whatever your banking institution is. I believe that's it in terms of updates. One other thing that I did just want to share with you all, we have relocated our office again. We are now back at the 200 Lamar Street location, which is where the rest of MDHS is. Up until actually yesterday, our office was located at in the same building as Child Protection Services, but we have now moved back to our original office. So we're back at 200 Lamar Street. Just wanted to let you all know about that. So just expect to see that on the state plan as our new address. We do, again, know where we're located. So just know that our address has changed again. Is there anything else, Angela, that you want to mention in terms of updates before we open it up for questions? Okay. All right. So at this point, we will open it up for questions. If you do have a question, if you will just type that question in the chat box. Again, we will not answer questions about specific childcare programs or specific certificates for specific children, specific families. If you have questions about specifically about your childcare or about a specific certificate or something, you'll need to email our email or email us, or you can call our phone number. So with that, I'll see if there are any questions, if y'all can enter those in the chat and we'll get to those. I'm not seeing any questions pop up. I'm going to give it just a couple more minutes. Let's see. If you've not received your after-school payment, what do? You need to contact Horn at the number that the number or email address, and I'll put that back up. It's the 601-258-3402, or go to the website. There's a contact us form. And again, you may have not, just depending on, again, I know that was sent out in direct deposit, so it may be an issue with that. Or, it could be something else, but contact Horn first to see what might be going on. Okay, let's see. Can you please clarify the process on the comps change of provider for children who have not attended a center? Angela, can you address that question?
Yes, for change of providers, if a child has never attended, so what you need to do is just put in the notes that the child never attended, and approve the request that they didn't attend, and then we will process it so that payment will not be issued on your behalf for that. But the process with that is, you guys know that parents have a choice on who they want as their provider. What I've been getting is that parents or providers feel like the parent hasn't reached out to you, so you don't know that, and then the certificate is approved. And once the certificate is approved, then you're having to complete that process. We're hoping to get the application updated a little bit to put one, notify the parent to not select a provider if you have not reached out to them. Hopefully that'll help out a little bit, as well as making sure that we are able to add that into the change of provider. So all you have to do is just select the drop down that says child never attended, so you won't have to put anything else. So I am looking to update that just a little bit to have that, since that's becoming an issue for many of you on that behalf. So for right now, just put it in the yeah, and that's because that's in that process. But once you can also send an email to CC Payment if you guys want it to be immediate. But as soon as you do that, we will they don't have to wait the 2 weeks. It's just that that's the process we built into the change of provider process in order to ensure that providers get their 2 weeks. So we did that to force the parent to be able to not wait to the last minute to process a change of provider form. So that is why it says that they'll have the 2 weeks. But we once we know that that parent did not attend, we can override that and approve it so that they can go ahead and attend the center that they need to go to.
Okay. Debbie, did that answer the question? Do we need to clarify anything? Okay.
It can, because you're saying you're releasing them, and so that's all we'll need. And just send it to CC Payment. So the question was, does the email need to come from the provider? And I said, yes, it can come from you to CC Payment, and we can process it that way.
All right, I have a question about bad weather days. Recently, we had tornadoes predicted. Of 85 children, 7 attended. Tornadoes were very close to our center. We were open because there was no state of emergency. It was a traumatic experience. Do you expect any changes in this rule? We can look at that. Bad weather days is going to be something rather difficult to implement. We can potentially look at that as a possibility, but again, it would be something that the feds would have to approve. I don't know, to my knowledge, if other states do bad weather days, but you do have those flexible days that you can use within the allowable closures if you want to use one of those for that.
Yeah, especially with the pay by enrollment, she still could use that because they're in attendance. They just weren't out that particular day, so you can use that and put that in the notes, and you will be fine.
All right, do we have any other questions? The question is there something that can be done on children being left at the center for more than 10 hours? They take advantage of us being that the children are on the program. I think we could potentially send out some correspondence to our parents and just remind them to be courteous of you all, and the fact that when you have to be open for longer periods of time, you do have to pay your staff. And it may be that if we have parents that are routinely violating that, that could be something that we could have a one-on-one with that parent, just remind them that, they are receiving these services from you all, and they need to be courteous and respectful of your operations. Because I do think that there are probably parents who are, I think that there are parents who know that, that know that we're paying they have a certificate, and they know that if they go over, and if you ask them to pay, usually what they do is they may jump to another program or something else. So I think I would have no problem with us requesting that our parents do be respectful. And I think that's within the I think that's definitely within the parameters of us expecting our parents to be professional in their relationships with you all. So the question was, what did Angela say about pay by enrollment? And so I'll mention what our pay by enrollment policy is, and then Angela, if you want to add to anything. So back during the pandemic, we had an emergency policy where we were paying you all based on enrollment, not attendance. And so even if a child was not in attendance, we were still paying you for that child if they were enrolled. Since the pandemic, we have made that policy permanent. So we are paying all children by enrollment, not attendance. Now, that being said, you still have to complete sign-in, sign-out sheets, and there still is an expectation for children to be present. What's the number of days, Angela, that we allow children to be absent?
Well, it's 60 days as of absences, ongoing absences. It's
Okay.
60 days.
Okay. Yeah. So, but, even if a child is not in attendance, for a day here and there, we still pay you for that child. And we feel like that was a policy that was necessary to make sure that you all are continuing to get, to get paid for those services, because you're still, paying your teachers, your building is still open, you're still having to buy food and supplies, even if children are not here and there. So we, so we, we did make that permanent policy change. Angela, was there anything else you wanted to add on the pay by enrollment?
So just want to add, so if you have a new child, just to give a brief example, if you have a new child that attends your center and they were supposed to start today, 5/1, but you got a call from the parent and said they did not start because of whatever reason. So they really didn't start till the following week. Well, when the ledger came out, even though they were supposed to start, because you need that first day of attendance to happen. So you would not start claiming payment for pay by enrollment until the child actually started. So you would do A's from 5/1 to 5/5. And let's say they started on 5/8, then that would be the first day that you would claim F. And then the child was out 2 more days. Well, then at that particular point, depending on what the code is, I think it's Y or Z, you would do Y, and then you can claim your pay by enrollment, because then you have a reason. The child started, they stopped, or they were absent. So you can use those codes. If they're on your ledger, if you look in the box and it has the payment code box, that's where you want to look at for your ledger. Now, if the child has been gone for 20 days, you haven't heard from the parent, then yes, can you do the pay by enrollment? Yes, but you still have to know where that child is. You need to know that, hey, this child's been out ill. That's why they haven't shown up. Because if we get 60 consecutive days at that particular point, you have to report that to us. So you can't just have kids and just claim an enrollment, right? That you have to know where they are. So if if a parent told you they're not bringing them back until fall, which, we're getting ready to go into summer, then that wouldn't be a pay by enrollment situation. You would need to decide whether you want to wait on to save that spot and wait on them to come back or whatever, or notify us. But you wouldn't be able to just continue to claim if they're not going to be there for 3 or 4 months. So you really want to just make sure you look at that and decide. But yes, that's all I would say about pay by enrollment.
So I see the comment about the rules to allow time to drop the child off and pick them up. We'll, if you all want to, hang on, Go ahead, Angela.
I was just gonna say, we pay by the day, so we don't look at the hours. So it's kind
Well,
of
I think,
difficult.
yeah, and I think it's just some suggestions about what the expectation would be there. Um, if you all want to send us some of suggestions there, we will definitely look at that. We are going to be doing a policy manual update after we get the state plan submitted because we will have to update the plan I'm sorry, the policy manual with some of the changes to the state plan, and we are going to be doing an update. We'd be happy to look at suggestions that you all might have. Because we have talked about including some codes of conduct for parents in our policy manual. So we would be happy to look at that. This question, if a number of children from the same family are in the custody of Child Protection Services, and I'm assuming one of the children does not have all of their documents for the child care certificates, the caseworker asks the provider to take all the kids. They assure you that the child will be covered, but they have not followed up on getting that certificate approved. What does the provider need to do to get this approved? I'm assuming the question is to contact CPS. You need to contact whoever your social worker or your caseworker is.
And you guys, I know that CPS, you guys are working with them, but please be mindful. If we don't have the information, it's hard for us to backdate a certificate. And many of you accept CPS kids and it'd be months before you get it. Stop it, because we do not backdate those certificates like that. And so I wouldn't want you to have 6 months where you're waiting on a certificate from our office, because if they submit the information and it's correct, the certificate is issued out in 24 hours. And we're not behind on any of that stuff. So that really goes out the same day as long as all the information is there. So I'm telling you, please do not, I'm not telling you not to accept the kid, but I'm telling you that you just need to not wait so long for a foster certificate to come to you. Because it does not take us that long to issue it. So that's what I'll tell you on that one.
So the question about safety and openings, I didn't really see a question. I just saw there was a comment about an issue with a crash in a large plate glass window. If something has happened at your center, that's like that, and you need to relocate, just as a reminder, licensing allows you to have a 1 mile and a 5 mile relocation area. So if you should have that location on file with licensing, and if you relocate because of an emergency, and in this case, I would consider someone crashing through a plate glass window. I'm assuming this might be at your center. I would definitely consider that an emergency. So you should be allowed to relocate those kids to one of those emergency locations. Now, whether or not licensing will allow you to open and full, for a full day, that's really just on, that's really dependent on what licensing would allow there. You said you were worried about opening, did not feel you could close because of closing rules. Again, you have some of those flexibilities, there. But if you have a location that you could, temporarily relocate to, I mean, in that case, you need to work with your licensing official. All right. So if you have a location that the licensing official has approved for you to temporarily operate at, we will honor that. We follow licensing's lead when it comes to where they allow you to operate. So if you do have an emergency location, or you temporarily, we're going to relocate to this other location, we would allow that. But you have to work with your licensing official. And let me just remind you, in the event of that, make sure you get something in writing from your licensing official. Even if they come out and do an on-site visit to you, make sure you get something in writing from them, just so you have a paper trail. Let's see. For clarification, Angela, did you say we can use the pay by enrollment for closures due to inclement weather?
Yes, I did. And as long as you put it in the notes that you had an inclement weather in your area, that'll be sufficient. So yes, ma'am.
Okay, let's see. we have a rule on thumb, no child can stay over 10 hours a day. It costs us money to stay open 12 hours a day. I will say, you all set your operational hours, and you're certainly within your rights to require parents to pay extra, if they stay over. You're within your rights, and that will not affect your status with us whatsoever. But that it is on you to collect that extra money from the parents that stay over. But we do not, if you like, let's say that you're open from 6 a.m. to 6 p.m. and you have a policy that says if parents are beyond 6 p.m. picking up their children, you charge X amount of money. You can collect that money directly from the parents. Now, I will say that policy has to be enforced for all parents. You can't just enforce that for subsidy parents and not private paying parents. But as long as that policy is the same for all of your parents, we don't have a problem with you having policies like that in place, and that will not affect your status with us in any shape or fashion. It says, please advise us what we need to do about parents who are delinquent with copay fees.
We have a form that's on the website that says that you can complete to us to let us know you have a parent that is delinquent on copays. We will reach out to them and let them know that they're actually breaking our policy and that they need to pay their copay fee. Now, just be mindful, we can only enforce the copay. So if you got late fees and all of that in there, because we're going to ask you, what is due to you? How many months are they late? Like that type of, we're going to need that type of information. And we'll reach out to the parent. Whatever you do, please do not sign the change of provider form if the parent is trying to leave your center and they owe you copay. Please make sure that you keep an eye on when you get those notifications, because it'll, if you know that parent owes you a copay, immediately go in your portal and go ahead and hit decline. And the reason why is because it's 7 days. If you don't touch it, it's going to roll. And then it's hard for me to hold the parent to get your money. So we will reach out to the parent and we will help you collect your copay fees. So the only thing that I want to tell you is please make sure you do not say, I just went on and hit approve on that change of provider form, because at that point, you're telling me that they don't owe you anything. And now you're sending me an email saying they owe you $500. So please make sure you do not approve the copay, the change of provider form if they owe you copays. But go online, it's a copay delinquent form there, and you can complete that and we will reach out to the parent and work with them to get the copays collected.
Okay, do we have any other questions? We've got about 9 minutes left, but I won't hold everybody hold everybody up if there's no additional questions. Okay, I'm not seeing any other questions pop up, so we're probably going to go ahead and wrap up for today. I just want to say again, thank you to everybody who joined us. We do really think that these are valuable opportunities for us all to share information with you all and give you an opportunity to get clarification on things. So we're going to continue to keep these information sharing sessions going. So I appreciate you all. Thank you so much for all your hard work. Thank you for all y'all do for our children and our families. I don't think anyone really understands just how hard y'all work and just how valuable what you do is, not to just children, but to families, but to our state and to our state's well-being overall. So I appreciate you all so much for what you do. And we're looking forward to continuing to do more for y'all, to supporting y'all, and opportunities like this are opportunities for us to do what we do better, or do a better job by supporting you all. So thank you all. I hope you all have a great rest of your Wednesday, and we will see you at the next meeting.
Yay.